You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Now, here's our host and founder of the Pharmacy Podcast Network, Todd Eury. Welcome to This Week in Pharmacy. TWIRx is the #1 weekly talk show about the profession of pharmacy.
Heck yeah. All right, I'm not gonna subject you to such horrible rapping. Not a rapper. Will never be a rapper. Welcome to This Week in Pharmacy. It is February 6, 2026. If you didn't know it was February already, it's February 2026. It's going too fast already. That's the way it goes. I am excited to be here with you this week in pharmacy. We have a lot going on, a lot to cover. We have two really special interviews that I know that you're going to enjoy today. I enjoyed talking with both of these dynamic individuals, and actually three special people. And we're going to be talking with Johny Kello from he's the CEO of MatchRx again. He always brings us great information. Saeed, Dinno, who's his guest, pharmacy operator, pharmacist. And then a shout out to Jonathan Adley. He's the CEO of TJM Labs. If you haven't heard about TJM Labs, you got to look into them. It's all about artificial intelligence and the impact on pharmacy and the pharmacy world. I'm excited to be here with you. Like I said, there is so much happening in our profession. If you are at all in that boat that you think the profession is in disarray, it's coming out of disarray, and there's so much opportunity out there right now. We're going to be talking about a lot of it today, but first up, workforce strategy for independent pharmacy owners. What a great podcast that we did with CEO of Eury Pharma, Stephen Beckman, who's the host of the Executive Dose, and he digs into this through a partnership with the Independent Pharmacy Cooperative and their insights from Kelly, as well as a pharmacy owner, Bill Drilling. And they really talk about how this makes a big impact to the profession, as well as to the individual pharmacies or even a chain pharmacy, and the importance of workforce strategy and what that means for you as a pharmacist and pharmacy owner. A shout out to the Pharmacy Podcast Network. Thanks so much for a great week of content. If you don't know, we're working with GRX Marketing and Finch Marketing. And you know what a SWOT analysis is: your strengths, your weaknesses, opportunities, and threats. Probably got that wrong, but mastering your SWOT analysis, definitely take a listen to that. It's a good show. Tamara Ruggles, Dr. Ruggles is back, and she has Deborah Milto on from the Indiana, Pennsylvania area. And Deborah is a long-time friend of mine. She's the past president of the American Society of Consultant Pharmacists. I worked with Deborah for a short period of time, directly and indirectly, from Diamond Pharmacy Services up in Indiana, Pennsylvania. It was great to work with them over the years. And I'm just proud to know these people and what they're doing in the profession and how they're making an impact to our profession. So take a listen to that. And it's very inspiring to listen to the conversation with Deborah and with Tamara. And I really enjoy it. I enjoy listening to the stars of our profession. That's why I do what I do. All right, the 50 most influential people in pharmacy, the awards. We've broken that down into several pieces. We're putting one out every Saturday. This was episode 2 of that 4-part series. If you haven't listened, just the awards were so much fun, and we celebrate so many of the people that have made impacts to our profession, and I rise them up. I raise them up and say thank you to all of you who participated and who voted, especially, and just thank you so much. So February 6, 2026, what's happening in the industry? Well, first of all, retail report comes out today from Credence Research Incorporated, and it says the retail pharmacy market to reach 1.97 trillion by 2032, driven by the aging population, digital health expansion. Once again, from Credence, this just came out today, and it goes into the breakdown of their markets, the breakdown of the percentage of growth, as well as they list some key growth drivers reshaping retail pharmacy, the aging demographics, the strength of technology in place, accelerated by artificial intelligence, and e-prescribing, e-pharmacies, digital health. Just a shout out to our listeners. How are you going to play a part of this? How are you in chain pharmacy or your independent pharmacy, your health systems, your mail orders, these online? How are you going to capitalize? And we think we have people, we have organizations, we have associations involved in this network for you to capitalize on. If you ever wonder about any of that, you can reach out to us. You can reach out to me. You can even reach out to some of our hosts. They're all accessible to you, and just asking for advice, especially if they're experts in something or one particular space within pharmacy. But I think that's good news. 1.9 trillion as a market, inclusive market by 2032. And I'm a small, tiny part of it. All right. What about news coming off of the New York Post just today? And the headline is Walmart boost pay for pharmacy staff with some jobs requiring no college degree. And I don't think this is a surprise to people in the industry, but it might be to the public, of being able to really grow and refine the quality of our pharmacy technicians and our certified pharmacy technicians. We've done several partnerships over the years with Mike Johnston's team over at the National Pharmacy Technician Association. He actually made the Pharmacy 50 list again, and how important our pharmacy techs are in order to grow a new pharmacy system, a new pharmacy delivery model throughout the country, especially parts of the United States that are suffering without pharmacy services. And it says the Arkansas-based retail giant, which recently topped $1 trillion in market capitalization, says it employs about 35,000 pharmacy technicians and 15,000 pharmacists across about 4,600 pharmacies nationwide. Pharmacy technicians previously earned an average of $22 an hour, meaning the new pay scale represents a potential increase of about 84% at the top end. That is such good news. This is Walmart said not all pharmacy workers will qualify for the $40.50 per hour rate, while with salaries varying based on employee credentials and locations. I still want to say congratulations to those techs that might be listening out there. You did make national news. Pharmacy made national news, bringing to attention the quality of person, the quality of work ethic, and the quality of your knowledge and experience as a pharmacy technician. You are not in fast food. You are in healthcare. You are in pharmacy care. And you're an extremely important part of the ecosystem of pharmacy. So good news to hear. Out of Drug Topics just today, headline, Medicare reforms aim to pay pharmacists for clinical care. Once again, Medicare reforms aim to pay pharmacists for clinical care. And this comes from Jim Lewis. He's the Senior Director of Policy and Advocacy for the American Society of Consultant Pharmacists. And he's quoted in saying that Congress is debating whether or not it's going to pass the funding bill that includes some PBM provisions. There's still a lot more that need to be done, prevention of vertical integration, stuff in the Medicaid space. So there's still a lot of work on PBM reform. There is a lot of work on PBM reform to do, but we have two massive updates that impact us at a federal and a state level, as well as the FTC. I cannot wait to share these with you. It's going to be coming from our friend, Greg Reibold, who is the legal lead for APCI, as well as our go-to person for PBM reform. I cannot wait for you to hear this short interview with Greg to bring us up to date. But major things happening in the pharmacy profession this week. Before we go to Greg Reibold, Mr. Reibold, I do want to give a shout out to all of those people attending the Pharmacy Profit Summit live in Dallas, Texas, March 28th through 29th. Pharmacy Podcast Network will be there. We're going to be covering this with bells on. I love this conference. I've gone to every single one of these since the very beginning. I don't know if this is number 6 or number 7. I've been to every single one except for last year, where we had to attend the American Pharmacists Association's annual meeting. But we are absolutely making this Pharmacy Profit Summit a heads up to pharmacy owners. If you really want to attend a pharmacy conference that digs down into what really is rubber meets the road and what actually works as pharmacy owners to increase your revenue, this is the conference you want to come to. This is the conference that you want to be a part of and listen to people when they're speaking, that they speak from experience. They speak from actually getting it done. And the conference is run and is founded by Dr. Lisa Fast, a pharmacy owner. She's been a friend of mine for years. She's been on the Pharmacy 50 list as an influencer because she is. But she's bringing together some people that really make sense. And I'm excited to be there, excited to dive into aspects of business like Jonathan Adley, who's going to be talking about the truth on AI. What is true as a pharmacist? What is true as a pharmacy operator versus some things? There's a lot of companies out there who will claim they get AI, but I have to say, just like you might say, hey, a lot of companies get podcasting, right? So you want to podcast through the pharmacy profession, throughout the pharmacy profession, and you want to podcast to the consumer group, and you want to partner with an organization that thinks the best of and the highest level quality of pharmacy care and pharmacy services. Why would you work with an outside organization that knows nothing about pharmacy, doesn't have it in their heart? And that's the way I think of artificial intelligence. That's the way I think of Jonathan Adley and his team from TJM Labs, and just the immense amount of attention that's brought to that. You're not going to want to miss this episode and this interview with TJM Labs CEO Jonathan Adley. Can't wait for you to hear it, coming up here on TWIRx. And my friend Mike Johnston, CEO of NPTA, is going to be there talking about the importance of your techs, who we just went through the raise of pay for Walmart techs. And that means that the value of our techs is absolutely going up. You should be taking care of that. Shout out to Stephanie Zimmerman, who's going to be at the Profit Summit Live. And she has decades of leadership in pharmacy business growth. She's going to have some strategies in the insurance billing secrets PBMs do not want you to know. And just so excited to be a part of this. So if you are not registered, if you're not signed up for the Pharmacy Profit Summit Live, go to pharmacyprofitsummitlive.com. Once again, that's pharmacyprofitsummitlive.com. And I will see you there. And that is for TWIRx News. But be on lookout. As soon as we come back, we are going to give you 2 major announcements in pharmacy news that impact the entire profession. You are not going to want to miss this. We'll be right back.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hi, I'm Darren Teeting, Chief Operating Officer with IPC.
Hey there, welcome to TWIRx. This is our special feature and a returning guest, a friend of mine, Johny Kello, CEO of MatchRx. Johny, it's so good to see you back.
Hey, thanks, Todd. Thanks for having me again. I loved the first two episodes with Elisa Bernstein and Day Lee, talking about with Day, at least Trump RX, and with Elisa, all the things that are DSCSA, that matter and that are coming down the pipeline, which requires even further and further discussion as we near November 27th, 2026.
Yeah, two powerful episodes. Our first that featured MatchRx was bringing to the table Elisa Bernstein, one of the Pharmacy 50 most influential people in our profession. Very proud to have had her on talking about DSCSA. Then we switched gears and we were really digging down into Trump RX and how there's just so much unknown right now. And obviously we just heard about the new federal legislation being on the desk of President Trump to get that pushed through. And I'm sure that we can invite back many of the people that you've recommended, including Dr. Day Lee, PharmD, with his team, and how deep the knowledge is in these spaces and how fast things are changing. You started this insights and started giving us this data and started bringing these conversations to us, Johny, in November, and look how much has changed in February of 2026 already. It's dynamic.
And today we've got another exciting guest, and Saeed Dinno is a PharmD, runs a group of independent pharmacies. A lot of excitement, and really today's discussion is going to be revolved around generic compliance ratio. The GCR, that magic acronym that pharmacies are trying to calculate on a regular basis, isn't always straightforward. And then having the right GCR, but also being able to shop outside of your contract so that you can really make the difference in the bottom line. So with that, I'd love to welcome Saeed onto the show.
Dr. Dinno, welcome to TWIRx. It's good to have you here.
Thank you. It's an honor being on here. Appreciate the warm welcome.
Sorry, Todd. So, Saeed, look, a lot of pharmacists are dispensing, more than ever, but they're keeping less, and you know that as well as anybody. But today we want to talk about one of the quiet metrics behind that. And most pharmacists get it, but when you dig down deep, it gets a little bit more challenging to actually track and calculate. So I want to, in plain English, I'd love to hear you explain to us, the GCR and in policy, but not necessarily theory. How does it work day to day? Your behavior, your team's behavior, training your team to understand where they should be buying on a regular basis. So,
Perfect.
Yeah,
thanks, Johny. So really, GCR, like we said, is the generic compliance ratio. Plain English, it's pretty much what's your percentage of generic purchasing compared to your brand. Let's say you're getting $100,000 in brand purchasing, and you're getting $20,000 in generics. That puts you at a 20% ratio. Okay, so that's really kind of the basis of it. And why is that important? I would say just because it allows you to unlock certain rebate levels with your wholesaler, depending on whatever your contract is. So understanding and knowing where you stand, where a pharmacy stands in GCR is very, very important.
Thank you. And I'm going to just back up a little bit, and I'm going to let Todd kind of give another intro to Saeed about all his, who he is, where he spent his time, what his specialty is. And Todd, why don't you kind of just touch on Saeed's, background and why he's sitting here in front of us.
Saeed, as a pharmacy owner, somebody that runs a pharmacy and then has layered your experience to bring on other pharmacies, which is now challenging in any growth to now embrace a community specifically. I think that in and of itself, that could become more books, more education for some of our new owners. The survival of independent community pharmacy is really in the hands of the owners and of the designers of the services you provide. And, you have background as a director of operations. That's very different necessarily than my realm, which is more about public relations and marketing, even though that can become part of it. But you really have to pay attention to the minuscule data. You have to pay attention to the costs down to the penny, especially with the temperament and the temperature of the challenges that you're going through. Expand for our listeners things that you've done to layer your experiences to come to this point and being prepared for scalability.
Yeah, thank you so much. So, by trade, I'm a pharmacist, been a pharmacist for over 16 years. Most of my time has really been spent in the management side of multi-unit operations, worked in the chain pharmacies and then, of course, in the independent space where I've spent the majority of my time. I like to help stores kind of run better day to day, working closely with owners, managers, really on workflow, staffing, purchasing, and plus margin, of course. What really stood out throughout the years is that, how small decisions behind the scenes show up later in the numbers, and specifically also with, of course, profitability with GCR. My current role, like you mentioned, director of operation of a group in independent pharmacies in the Michigan market. A big part of my job is helping in the daily operation plus profitability. Drug purchases play a huge role of that, and the way we buy drugs really influences kind of the end of the month, how our financials look like, and if there's space for us to kind of breathe, like I like to say. I've seen pharmacies really struggle with profitability, even having strong volume, and really simply it's because they are not aligned with their current contracts of purchasing, and GCR kind of shows up all over that. So once teams really understand how purchasing behaviors affect their profitability, the picture really changes at that point.
Right. Thank you, Saeed. That's a great overview. And again, tell us, why it's important and where does this all tie in between your primary contract buying with your wholesalers and then opportunities to be outside of your wholesaler to be able to purchase so that you can have the maximum value on each purchase?
Yeah, absolutely. So really GCR, everybody has to understand, every pharmacist, pharmacy manager, owner has to understand where GCR stands, okay, for them to really be able to make a meaningful impact. And when something that pharmacies don't understand sometimes is when you're not hitting your GCR, it's affecting the larger picture. It's not just those rebates on their generics, but it's also on the brand names, which we'll talk more about. Whenever you maximize your GCR, this is when, from your primary wholesaler, this is where it unlocks the space where you're able to now go shop from secondary, and really drive additional dollars to your margin at that point. But again, it all ties in with pharmacists and pharmacies understanding what their contracts are and understanding where they stand on a regular basis with their purchasing from their wholesaler.
Great. So tell us, what doesn't it measure? Because we always talk about what it measures. It measures your total purchases against your generic purchases, and it's a sliding scale based on your reimbursement, or rather your rebate from your primary. But what doesn't it measure so that when you do go outside of that, you're not affecting that GCR?
Yeah. So when you're looking at pharmacies, two pharmacies, and you're comparing them, it doesn't measure really the financial health directly of a pharmacy when you compare two together, because each pharmacy might have a different contract from their wholesaler. So understanding what truly the contract is, that's what allows you to have a better understanding of that pharmacy. So you cannot always compare two pharmacies. Oh, I have 20% GCR. Okay, that doesn't make a difference on the second pharmacy that has a completely different contract with their wholesaler. So you have to really understand how it relates to that direct contract rather than comparing my pharmacy is at 25% GCR. Well, that's fine. It doesn't make a difference. You have to understand what the contract is first. So
for the more experienced pharmacies that already track their GCR on a regular basis, and they're doing exactly what you're saying, and some of this might be more of a refresher course for them. Imagine you're talking to a new pharmacy, somebody who recently out of school is working for a pharmacy, who wants to improve, or who recently purchased or opened up a pharmacy. Talk to them about, what you would explain to the pharmacist who's never thought about it before, or at least thinks about it, but really doesn't know how to implement it. And that's the key here, I think, is that people know about it, and a lot of the veterans really understand it. But then there's a segment and some of the newbies that are in the space who, don't think about it, or if they do, they still aren't clear on how to apply it on their day-to-day business.
Very good. So I explained that GCR, again, generic compliance ratio, it's like your report card with your wholesaler. The wholesaler sets expectations around how much you are buying in generics. Hitting your GCR means you're meeting their expectation, which then gives you and unlocks different levels of rebate back, both on generics and on brand name. And I'd like to explain that it's very important to not forget the rebate that you get on the brands, because that really unlocks a larger dollar amount back into the pharmacy. So this is very important. One, understand what is your contract with your wholesaler. I hit 18%. What is my rebate, one, on generics? And what is my rebate on brands? I hit 20%. How does that look like? And that's what pharmacies that really manage this process and understand it pays off really well. I'll give you an example. Looking at a high volume pharmacy that was consistently, and this is recent, was hitting below 18% on their GCR. And they're like, no, we're purchasing all these drugs, from outside sources. Okay, no problem. But what happened is they were missing out 2.5% on brand rebate. As soon as they hit with their contract, their 18% in that specific case, they unlocked $10,000 extra a month in brand name rebates, which is significant to the bottom line. But at that point, once they unlock that, then there's no additional incentives to pushing your GCR from 18 to 20 to 25%, for example.
Yeah, there's a point of diminishing returns, is what you're saying, or there's a point of there's no added value to having met your GCR. Once you've met it, recognize it, and then take advantage of outside sources. To put a selfish plug-in, you can use MatchRx for buying outside of that, whether it's for generics on our wholesale side or with other pharmacies. But leave that aside. But I would say there's a point of diminishing returns or no return.
Yep.
And the generics are where the wholesalers are making the biggest spread. So they obviously want you to buy all your generics from them. But once you've met that threshold, then it's time to really be focused on looking outside of that. Is that fair?
That you hit it right on. That's exactly what it is. Because as soon as you hit your tier where you're maxing out your brand, that you leave yourself a little cushion and then shuffle that additional purchase in from your secondaries, okay? And then you're really unlocking a lot of additional dollars to your bottom line. There's no point of pushing your GCR any higher after that. And again, this happens with, pharmacies being regularly just used to always buying everything from one source. Well, you're leaving a lot of dollars on the table at that point. So I encourage understanding of your contract and then knowing when you've maxed out your rebates and shuffle that dollars. Okay. So it's a very important thing.
So talk to us about minimum requirements from the wholesaler in terms of total volume. Is there a threshold that needs to be met? Say you have to buy $300,000 or whatever the number might be on a monthly basis for you to even reach a threshold, or is it just purely the ratio that matters?
Truth to be told, depends on the contract. Some wholesalers don't have a minimum, some do. I'm working currently with one great plan, but it's $75,000 in monthly purchase. So when you have a newer pharmacy starting up, it's difficult for you to hit that $75,000 right off the bat. So then you're not maximizing your rebates. For a pharmacy like that, truth to be told, I tell them go heavy on secondary purchasing. Don't throw all your dollars to your primary, because you're never going to max out on your ratio, on your GCR, and you're just giving them extra dollars that at that point purchase from your secondary, make that extra money on your bottom line. Now, when you start to build up and you're hitting those tiers, no, bring those dollars back, maximize your GCR, and then reallocate. But that brings us back to understanding, having a deep understanding of what your contract.
Right. Thank you.
I have a curveball, Saeed. So
yeah,
this is something that I'm really interested in. So 5 years ago, I would not have asked you this because it didn't exist. Today, we are seeing a trend that's going to continue to grow in the realm of cost plus, and the realm of cash-based, in the realm of getting completely away. There are pharmacies out there, 2 of them in the Pittsburgh area, right in my own hometown, that do 100% cash-based businesses. They're going to be leaning into clinical services. They're going to be leaning into other ways of making money. So what you're describing for our podcast listeners today is relevant because it's here right now. This is the business model. But will this business model continue to transform into something else where GCR and the overall profitability of our pharmacies, it will evolve into something different than what we're talking about today?
Yeah, I think so. At that point, these pharmacies that are cash plus, model heavily rely on generics. Okay. And at that point, many of the large wholesalers, they wanted your generic purchasing. And then they give you the brands at a better price because you're bringing them X amount of volume. If you're a cost plus model and you don't have a lot of brand name dispensing, then you're no longer tied to your primary wholesaler. Those are when I encourage these pharmacies to go heavy on their secondaries and really getting a better rate on their generics. Of course, they're still going to have brands that they need to dispense, but dispensing $1,000 brand name that you're paying out of pocket, you're going to see a little bit less of that, in my opinion, in the cash plus model. It's going to be more heavier on generics. And truth to be told, there are patients that are on a regular basis with their insurance, they're overpaying for many generics. And the pharmacy, is not allowed to let the patient know that, hey, you can get cheaper through your cash pay option. So these models will continue to grow, and it's interesting to really see where that's going to navigate to in the next few years.
So is that where you're seeing good pharmacies accidentally hurt themselves?
Yes. So we have pharmacies that at times they don't understand their contracts, and then they're either buying out too much or they're buying in too much from their wholesaler. walking in blindly and making purchases blindly, just thinking, hey, I'm always getting the good pricing, the best price, that's not the reality. You have to kind of micromanage the process. And part of that is really kind of for the pharmacist to keep it in the back of their mind always. Am I getting the better price? How does that look like with my GCR? Where am I with my contract? And what is the model of the pharmacy? So is it a typical open door insurance pharmacy, or are we talking cost plus model?
Great. Thank you.
All right. And then let's take this same data, let's take the same way of thinking and the coaching that you're providing on this podcast, Saeed, is extremely valuable. Let's add in another slight curveball, but it's not really that much of a curveball because I'm sure that your pharmacies have been doing this all along anyway. So pharmacies, community pharmacies, independents are finally getting paid to deliver long-term care pharmacy at home services in a way to actually now shift and do it from a compliance perspective, actually follow, the formats in order to be reimbursed properly. So when you start mixing that into the ingredients, now you have an independent community pharmacy that have almost a little sprinkling of a couple different models under the same roof. Like one is the straight community retail environment where GCR plays a big role. Another is maybe a club membership that includes, some clinical stuff and some services. And then now we have this long-term care pharmacy at home where you get to, as long as you're compliant with long-term care standards for the home-based services, you can get reimbursed in a different way. Talk to us a little bit about that dynamic too.
Absolutely. Long-term care at home is exciting, and it's a new thing that we are seeing with the pharmacy reimbursement. Reimbursement seems to have a little bit of a better edge on it. So again, we go back and the bottom line on the insurance is only going to pay X amount. The next level is to kind of try to drive that additional profit, is making sure that our pharmacists understand and where purchasing need to be from, really dropping their cost, their drug cost. So that is an exciting thing that we're seeing with the long-term care at home. So we hope to see continue it. And again, like you mentioned earlier, newer legislations coming through, hopefully, empowering pharmacies and providing more better reimbursement for the independent space. So we're excited to see what's next.
Saeed, let's try to simplify this because we talk about GCR and managing and monitoring. Could somebody conceivably just pick a number based on their volume, based on their purchasing from their wholesaler on a historical basis between brand and generic, and say, hey, look, I know that if I buy $10,000 a month or $15,000 a month outside of my contract with secondaries, then I feel comfortable that I've met my other requirements in my contract, because sometimes people don't want to go through this entire, brain damage, right? And so how do we simplify it for some farmers to say, hey, look, pick a number. I'm going to buy, I know I can buy 10,000, 20,000, whatever that number might be outside of my contract, and I've still met my obligation and maximized my rebates on my primary. Is that a kind of a simplified approach to buying outside of your contract?
1,000%, Johny. If you want to simplify it, that's probably the easiest and simplest way. Say, I have a X amount I'm allowed to buy from outside sources, secondaries. Once you hit that, then the remainder of purchases should be from your primary. Okay, that's if you want to, keep it as simple. No complications to it. I do encourage, however, always, personally speaking, I like to see, our screen's green when we adjudicate a claim that you're properly getting reimbursed. So I always encourage saying, take a look at your dispensing and identify drugs that you're regularly losing money on. And those drugs, for example, estrogen patches, or birth control, commonly come back as negative reimbursement. I tell pharmacies, go ahead and make those a habit that these just automatically goes to your secondary supplier. Purchases from there, get used to replenishing from there, and it just helps you. Now, to keep everything balanced, yes, I love your idea of having an X amount kind of a budget, knowing, hey, don't go over that 10,000 or 15,000, whatever it might be, of purchasing from outside. So yeah.
Yeah. So what you're saying is there's a double win here. One is pick a number, buy it outside the contract, and B, pick the products within that amount of negative reimbursement. So now not only are you getting the best pricing because you're shopping outside, but you're also still not affecting your rebate. So like, again, a real simple strategy. Here's the dollar amount. It's 5, 10, 20,000, 30, whatever the number might be. And within that amount, pick the items, pick the drugs that are primarily a negative reimbursement for you so that you're at least either breaking even or making a little bit and not falling backwards and affecting your bottom line.
Absolutely. That's a really good way to put it, Johny. I like it.
Well, I'm a simple person, so that's why I can come up with simple ideas.
Perfect.
Talk to us about what really moves the needle for pharmacies. I know you try to break it out generally into like 3 buckets. So Tell us a little bit about that and how do you approach it regularly? Again, in simplified ways of executing this plan.
Yeah, absolutely. First things first, I encourage every pharmacist, every manager, pharmacy owner to understand your contract with your wholesaler. Okay. Once you understand it, that's number one. Number two is then kind of just making it part of your daily behavior with your team, with yourself, is that you're checking how are you doing overall with your GCR? Are you going to maximize your primary wholesaler purchases? And then from there, really shop out, go to your secondaries, and take a look, like we mentioned, on those negative claims that you're losing money on. Move those to your secondary suppliers, and your P&L will really love you at that point. You'll see a nice, fruitful return on your bottom line. So
let's like brass tacks, right? Because this it sounds great. Okay, I'm a pharmacy. I'm doing $2.5 million a year. If I simplified it into a plan of buying X amount, how much can I really save under this plan? Is it 1,000? Is it 10,000? Is it 15,000 a month? Give us something that's tangible that people really can sink their teeth into and say, oh, if I spent this little amount of time to stay focused and understand, here's the real payoff, dollar for dollar on a $2.5 million pharmacy. I picked that number because it's relatively average.
No, so like a pharmacy that like you mentioned, 2.5 million can really unlock in depending on their contract. If let's say they brought in their brands and generic purchases to their primary. They can really unlock an additional, just depends on their contract, 2% maybe, okay, of savings on their brands. So extrapolate that. What does that look like? And then as soon as they maximized their GCR, shuffle that additional dollars. I mean, just the other day, like I mentioned, I had a pharmacy that, could potentially get an additional $10,000 a month from brand rebate if they properly structured their purchasing. Another pharmacy was probably ordering an additional $6,000 in monthly generics from their primary, but they were not receiving any additional GCR. Their top tier was 20%. They were at 25% GCR. There's absolutely no reason. Take that additional $6,000 in purchasing from primary, buy it from secondary, probably costs you, $4,000. You kept an extra couple of thousand in your pocket. Yeah. So I really encourage kind of diving deep into those numbers for your pharmacy.
Great. Thank you. Yeah. And that's tangible. $2,000 a month. Can $25,000 a year or even more, depending on how aggressive you want to be and what product types you're buying. You can save some real dollars. That pick where you want to put it. Employees, personal growth, a business. Put it in your front end. where you're going to be, you're not tied to rebates or anything else. And, we won't, that's a whole different show talking about the front end. But really, when you talk about savings, you've got a plethora of places to put it in: your kid's education, your wife's new shoes, or your
There's a lot of those.
or your husband's new wallet. But the bottom line is that it's your money. Recognize that, and take advantage of what is a simple to follow tool and really become impactful. So, anyways, I digress. Tell us a little bit about the other, points that you like to keep an eye on, whether it's your dispensing awareness or your operational habits on how you train your team, because it's not about just doing it yourself, right? We all know that the best pharmacies are run by a team, not one person trying to do everything. And that's any business. At MatchRx, we've got 40 people here. I can't do 90% of what my team does. We're fortunate enough to have great team members. That goes with any business, including pharmacy. So tell us a little bit about, how you are actively training your team, following up, and encouraging them to really think like an owner.
Absolutely. So really getting them involved. I like to have everybody involved, in the pharmacy team and understanding why, like what's the reason behind, okay, really this drug has to be purchased from this supplier rather than from primary and vice versa. And having the why, understanding why behind it, it really allows them to understand why we're doing this. Another thing is kind of teams have to understand to be proactive, not reactive. A lot of times they go to order drugs and it's out of stock. They need to order it, have it by tomorrow. That way they can have it for the patient, and 1,000% understandable. But sometimes you have to take a look at proactively, what are the medications that are coming up to be filled? Okay, our 90-day supplies and so on. And ahead of time, if, for example, you're doing great in GCR, go ahead and shop out your secondaries and purchase these drugs. Now you're fulfilling ahead of time, ordering them ahead of time. So part of that is, again, is the habit of the pharmacy team members. Another thing sometimes I see, issues arise is contract pricing change with primary vendors. And the technicians comes, or the pharmacy member comes and immediately just reordering the exact same NDC. And that's a big problem, because you have to resubstitute depending on your platform. Does it allow to automatically substitute to the preferred generics? You don't want any generic purchasing that doesn't go towards your overall generic allowance by the wholesaler, because not every generic manufacturer that you can purchase is going to go towards your GCR. So again, these are a lot of things that they have to understand. A lot of tidbit as well is understanding the contract. Sometimes there's some carve out from brands or total purchases. For example, depending on the contract, GLP-1s medications, some specialty drugs, dropship drugs. So having an understanding that, if I'm about to order a $2,000 dropship item, is this going to count toward my GCR or not? Okay. A lot of times it does not. So it gives you a little bit more room. Then you don't think that you need to move as much from secondary to primary at that point, because you're accounting for an item that doesn't count against you. So it all goes back to kind of educating the team, working with them on a regular basis. And, we really do see pharmacies that are able to turn around once they get a handle on their purchasing.
Okay. Yeah. So, let's talk about that denominator, that GCR denominator, right? And it's heavily weighted towards the brands because those are the most expensive ones, right? Is it in the best interest of the pharmacy to buy sometimes outside of their primary, because they don't have a minimum, or they constantly meet their total minimum, but buying a brand outside of it, whether it's through a secondary or through a marketplace, because again, that continues to lower that GCR compliance number, because that denominator with the big ticket item is less, and it gives you more exposure to being able to buy more generics outside of contract.
Absolutely. So, I mean, if you are able to shuffle some brand name drugs outside to secondary, that's a no-brainer there. As long as reimbursement on these typically can offset the price of how much you're purchasing these brands for. If you're getting toward the end of the month, I always encourage, you don't have to look at your GCR on a daily basis. And especially in the first couple of weeks of the month, I always say just, it's fine. Don't look at it yet. Have it in the back of your mind, but don't look at it yet. Once you get to halfway through the month, start looking at it. And one of the things you can do is, one, bring in some brand generic purchasing back to primary, or two, certain brands, if there's enough margin spread on them, take them out, buy them from secondaries, and that goes away from your total purchasing from your, your formula of how much you're purchasing. And then automatically your generics is going to look higher, your GCR. So that's another way kind of playing around with that number.
Yeah. And we see that sometimes in the marketplaces that we operate in as well, is that members will buy, not necessarily just for GCR, just because for the need of the product, where it's not always available from the primary, but the added benefit is that it lowers their denominator on their GCR numbers. So, and
to be frank, I mean, Match is a great resource for that, to getting some of those,
shameless
brand names.
Plug, Saeed, thank you.
I mean, it's true to be told, so.
I appreciate that. Thanks for being a member too. All right, so tell us, because we want to try to start winding this up, but give us like some fast wins and what's one change that feels uncomfortable at first, but pays off. So those are two different questions, but sometimes they're one and the same.
Well, I'm going to repeat this, but something uncomfortable that pharmacies can do first things is just calling their rep for their primary wholesaler and be like, can you explain to me what my contract is? I promise you, majority of pharmacists don't dig deep into that. So that's the most uncomfortable first thing. Once you understand it, then you can play with it. You can really dive into it and push the numbers and move the needle at that point. So I encourage you, call your rep. They'll be more than happy to answer those questions and see you engaged to learn about it. And then, know your numbers. Once you do that, right away, you're going to start seeing a big benefit from it. So like, I don't know about you, but do you have like a cheat sheet that next to your computer that talks about where those numbers are, your thresholds, or is that between the ears? Because somebody who's new might say, hey, I understood it, but I forgot the numbers, or, I'm not clear, or it's something that you want to share with your team. Tell us a little bit about how you actually, put it in practice versus just, knowing it because you've been in the business forever. Personally speaking, I have an Excel kind of formula where I've developed for our plans, for our contracts, where we just plug in the numbers, and it kind of gives us a little calculation on how much is it that we need to, how much dollars we have to move out or move in back to our wholesaler. I don't expect everywhere to do that, but all your wholesalers, your primary wholesalers, should be sending you regular communications of what your GCRs are. And I would take that and kind of, if you're hitting your GCR of 20% or whatever it might be, then you're good. Keep a little cushion. Otherwise, reach out and try to figure that out. I do encourage, pharmacy owners and pharmacists to, develop their own cheat sheets of that. Okay. Because that just kind of lets the team know, and themselves, kind of an accountability thing that, you're constantly looking at it. So definitely encouraging to do so.
Right. And so they don't have to wait to do this today. They could, or move forward with this. They could look at their historical 12-month historical, and really based on that information, really determine where they've overbought from the wholesaler, their primary, or have maximized their ratio and been able to maximize their rebates. So, what I encourage to, folks is, don't feel like it has to start today. You could start today and look at your historical and really determine, your personal letter grade. Did you do a really good job of buying, and maximizing rebates and buying outside for extra savings? Or did you just hit the rebuy button and the simple, like, that was easy. You don't want the easy button all the time, because if you do, I'm betting you that you're losing opportunity for better pricing outside of your primary.
Absolutely. And in another thing is, if a pharmacy does not have a secondary, that's an easy win. They should sign up for a secondary to start seeing some savings. So not to rely fully on their primary wholesalers. So that's also an important thing.
Well, again, a shameless plug, but they can also sign up for MatchRx and look at over a dozen secondary wholesalers, and all in one place. So
absolutely.
So all right. So if a pharmacy owner only does one thing after hearing this episode, what should it be?
What should it be? Honestly, call your primary rep and understand what their contract is. As soon as they do that and they understand their contract, then they can move on the next things of savings. So
okay, and so I'm going to ask you one more question and similar, which is the pharmacist who's already done that, who's the experienced person. Give them something, because this is kind of like a round table discussion, right? I learn from you, you learn from me. Tell us what else you would teach, or at least worth mentioning, reminding an experienced pharmacist who already knows his contract well. What could they also think about doing that really could help them, put a few, extra dollars in their pocket on a monthly basis?
What I do see is pharmacies not identifying repeated underwater claims, and really predetermining, you can have a pharmacy that dispenses a lot of a certain drug because they have a provider right down the road that refers a lot of patients to them, but they struggle with that drug. Identify those, buy them from secondary. It will make a big difference for them, for those experienced pharmacists. And another thing is not to give too much to the primary at that point. Some of these experienced pharmacists, they like to get all their brand rebates, which is great, but then they just leave too many dollars on the table from their of purchasing from their primary wholesalers. So keep in mind, secondary does play a big role.
Great. Well, that's great. Great. Two great takeaways, but I think this episode, you really educated me on this.
Yeah.
In a lot of ways. And it feels like there's a couple approaches. One is, the student that wants to really understand GCR and follow it, or a simplified approach, which is, here's the fixed dollar amount I'm buying outside of my contract, buy some brands outside of my contract, and I can not have to go through the more detailed way. So there's more than one way to skin this cat in saving and maximizing your GCR. Is that fair?
Absolutely. Well said, Johny.
Todd, you've been quiet. It's not like you.
No, I'm like you. I was taking notes. I'm learning something here. I mean, there's a lot of good information in this episode. And Saeed, it's neat to see that you've extracted so many years of experience where you were part of a national chain who understood the first steps of operation as someone that was supervising. Then you move up into multiple pharmacies in that independent pharmacy space. And now you're kind of combining the world of a buying group as well as with pharmacy, independent pharmacy owners and operations. And I think there's a lot of gold in that. So you're going to have to promise to come back on TWIRx and dig into another subject, because this has been great.
Sounds good. Thank you so much. This has been great, guys.
Thanks, all right. Shout out to our listeners. Shout out to our pharmacy technicians, the right hand of our pharmacists helping us build these businesses. This is not about protecting your margin and not changing who you are as a pharmacy. This is about enhancing your profitability. This is about creativity. You are listening right now. You're coming up with ideas. If you'd like to share those ideas, if you'd like to engage with Johny and the MatchRx team, please reach out to Johny. He's all about getting people involved in conversations to really change the game and the profitability and what 2026 has to bring us. Johny, Kello, and the MatchRx team, this has been tremendous, and we thank you so much for bringing us another great interview here on TWIRx.
Yeah, thanks, Todd. I really enjoyed this one as well. Again, every one of these, it seems like I learn a lot, not just a few things. But again, I'm not a pharmacist, so I think that I've got more runway than the average listener, but I still love hearing these, and it really get really good pointers to pass along to our members as well.
Hey, if you missed episode 1 and 2, do not worry. We have a link in the show notes. It'll take you to all 3 episodes, and it'll make it easy to access. And if you have any questions, please reach out to the MatchRx team at matchrx.com. Can't wait to see you at a conference out there, Johny. Thanks so much.
Todd, have a great day.
Feeling lost with the complexities of pharmacy accounting?
In pharmacy today, there's so many different, variables and issues that impact the pharmacy books, records, accounting, the profitability of the store, so forth. There's different components of pharmacy that have its own nuances from an accounting standpoint. And so it's tricky. There's no doubt about it.
Ready to take your pharmacy to the next level but don't know where to start? Sykes & Company is here to help. Introducing the RX Assessment. With the RX Assessment, the pharmacy CPAs and advisors at Sykes will do a deep dive into your accounting and tax situation and give you the action steps you need to take your pharmacy to the next level.
If you're interested in, working with a team who understands the industry and how the accounting and tax should really be in a pharmacy, this is your chance to get a under the hood check of what's going on and getting the feedback of any issues or concerns or, again, things we think you're doing really well with.
Get the financial checkup your pharmacy needs and head over to sykes-cpa.com or call 252-482-7644.
Hey, first up on TWIRx, welcome back, Mr. Greg Reibold. It's good to have you back on TWIRx so quickly because I have a lot of questions for you, my friend.
Yes, sir. Thrilled to be back here as always, and big week in pharmacy. So lots to talk about.
Well, I want you to take over because there's something that's happening at the federal level that impacted PBM reform. There's something at the FTC level that now impacts the profession in pharmacy as well. Break those two down for me, or break them down for us.
Yeah, I promise you I will do my best, right? There's so much to, really so much to unpack here. But what I would say, big picture, one of the biggest weeks we've seen, probably the biggest week we've seen federally in pharmacy. And I don't want to be bombastic here, right? But I think that's accurate to say at this point. What we saw this week is as part of the large reconciliation budget bill, there were significant PBM reform provisions included within that, right? And a lot of these provisions are core provisions from our pharmacy's own Congressman Buddy Carter's bill that he had, and also consistent with what was so heartbreaking for so many folks back in 2024, as it was getting ready to be included in the year-end package. And then there was a sort of a tweet that shall go unnamed that sort of unraveled all of that, right? And so we're in a position now where we are seeing we're seeing the strongest, most meaningful PBM reforms ever implemented and signed into law, right? So passed and signed into law this week. I would say in broad strokes, what you'll see here is that, in the Part D space, you've got sort of this delinking concept, which is, hey, PBMs, you can be paid a bona fide service fee, but you can't make money off the price of a drug, right? So powerful concept. There's a lot of technicalities there and a lot of, I would say, nuance that has to be worked through. But conceptually, hey, PBMs, you can't exploit the price of a drug. Pretty powerful concept to get into law, right? In terms of pharmacy reimbursement, you've got these reasonable and relevant requirements that calls on CMS to promulgate regulations to ensure pharmacies are getting reasonable and relevant reimbursements, as well as treating some sort of certain pharmacies a little bit different to kind of protect them based on size or area. And then there's, I would say, really significant reporting requirements as well. So this is I think it's very important to say, like, this is not the end, right? I think the important thing is that is this going to be a catalyst to more reforms to protect patients, more reforms to ensure the sustainability of pharmacy? I hope very much so that that's the case, but this is a significant victory. A lot of folks have worked really hard on this. Frankly, I'm probably not the best person to be sitting here talking about it, right? Because I would say you've got, I mean, boy, you get philosophical, and I think of like Doug Collins, right, who's in the President Trump's cabinet now, and he was a leader on PBM reform, going back in the early 2010s, and obviously Congressman Buddy Carter has worked so hard on this. His staff, Jack Ganter, they've worked so hard, and NCPA has worked really hard on this reform as well. So I think it's hopefully a special moment for pharmacy. I would add, from a policy perspective, I think there's a lot of work to do to protect pharmacists, and we'll of course be working to hopefully advance pharmacists' fight back in that regard. But this is a moment that hopefully pharmacy should savor, and the folks who've worked so hard on it. So on top of that, right, like as though that wasn't enough, we saw a major settlement come out with the FTC and Express Scripts, right? Obviously, the FTC has been doing ongoing work in connection with PBMs and the 6B study, and they brought actions against the big three PBM in connection with high insulin prices, and what you see is really some fascinating things that are coming out of that. APCI, who I work with, has been a long time proponent of Section 5 of the FTC Act, which is unfair methods of competition, and really believing that a lot of PBM practices fall into that unfair methods of competition. And, it's something we've certainly been hopeful to see the FTC utilize. And so, it's kind of nerdy, right? But from my perspective, it was really exciting to see that sort of serve as a basis for, really a lot of what the FTC was doing there. And again, a lot of folks in the community pharmacy space have worked really hard to engage with the FTC. The FTC team has worked really hard and continues to work hard. And so just so encouraging. There were a lot of really good, interesting things within this settlement. Perfect? No, right? I think there's a lot of nuance, and we're still unpacking a lot of that nuance. Maybe we can discuss that, Todd, you and I, on the PBM Reform podcast or some other forum. But it's a big deal, right? You could argue, right, ESI waving the white flag here and resolving these allegations and agreeing to behavior or agreeing to practices that are going to hopefully curb some of the more unfair practices we see implemented by large PBMs.
More and more is taking place to really make the long-lasting changes that we've all known had to be made. Simple things like, if you're an insurance company, you can't own a pharmacy because it's just too much intertwining of rates of services and reimbursement and patient steering. And so it's just bad business. And we saw it happen. I know the majority of our listeners probably don't remember this, but the divestiture of the Baby Bells and yes, turning, our AT&T into 7 separate organizations because telecommunications was being reigned by one organization, and the government, the FTC, is like, hey, this is dangerous for the telephone and telecommunication infrastructure of our nation. We cannot allow one organization to have that much power over its people. Well, guess what? You're saying the same damn thing, but with people's health. You're saying the health of the nation cannot be controlled by 3 behemoth PBMs who are literally, in some ways, killing people. I mean, there are people that have died because of PBM policies. They might not have intended that to happen, but it's a domino effect of things that have happened that I think of Bill Schmitnick and his family. Yes. Then you and I have spent lots of time with Bill and his family. And
that's right.
This is what the truth that's coming out is. And by the way, it's black and white data. It's not any embellishing. We're not hyperboil. We're like, we really want, actually, I want PBMs to do what they originally did. They were wonderful, and they really made things simple, and, access to formulary information. And it was great. Well, go back to the value that you bring and and I don't have to tell you this, but you and I know that it's never going back to the way it was. It's from this point forward, it's really changing.
It is. And listen, I think if you're behind the pharmacy counter, boy, it feels like when is help going to come, right? And we've seen, but when you look at sort of in the aggregate, the work that's been done in states, and now you see like real reform happening at the federal level. I'm a broken record on this, Todd, but it is hard to pass a bill, right? And there are so many organizations, so many professions that advocate forever and never make any progress, right? And this advocacy, attempts are being made to reform the practices of amongst the biggest companies on earth, amongst the richest companies on earth, with armies of lobbyists. And so to see the reforms that are happening at the state level at the pace that they're happening, and to see, meaningful reform happening at the federal level, and to see the action the FTC has taken, I think it's a good, Friday afternoon, it's a good time to take a step back and reflect a little bit about how far the advocacy fight has come. And does that mean the work is over? Absolutely not. I would argue it's time to really, now it's time to roll back up, enjoy this weekend, and then it's time to get to work, because there's a lot more work to do. But there's a lot for pharmacy to be proud of, a lot for community pharmacists to be proud of. And again, I think kudos to Congressman Buddy Carter and NCPA on this, who've worked on this issue for a long time.
Absolutely. Just a shout out to all of them. Many of them I've been able to meet in person and see the passion in their eyes, and how it attributes back to, Buddy was a pharmacist in his community and a pharmacy owner, and he saw it firsthand of what it did to not only his own business and livelihood, but with the impact that it had on his community, and he hated it. He told me that's part of the reason now he sees being a state representative from so many different angles, and he has a lot of expertise and things that he's not an expert in that he can really leverage. So that's awesome.
It is. And again, no time to list everybody, but when you just look in the aggregate, obviously, Congresswoman Harshbarger and James Comer, and the hearings, who's chairman of oversight. Right. I mean, there's so many, and Senate Finance has done amazing. We can't name them all, but again, I think it's a good time, late, Friday afternoon. It's a good time for folks to reflect on, wow, like when have we ever seen this much federal activity on this issue? And it's it's significant, and I hope from a policy perspective, and we'll be having more policy conversations on PBM Reform podcast and doing deep dives, right? Because there's work to do, and so my hope is that this is very much, hey, we appreciate the work that's been done, and hope this is a catalyst for more good work to come.
I tell you what, Greg, it's so good to have you give us this update. It really makes it more simplified and understand it. I am excited that we're gonna continue the PBM reform podcast. If you're listening, if you have a state representative that that wants to talk with Greg, that wants to get involved, that wants to continue to refine this from that state perspective, as well as what's going to happen at the federal level, reach out to Greg. He's a huge resource. Thank you so much, APCI, for your support of the PBM Reform podcast. We're actually making so many more connections now, especially through like LinkedIn and Instagram, where we're getting new listeners listening to this podcast, where we're getting feedback where they're saying, wow, I can listen to updates on things that I didn't understand what that meant. And now we have someone that is either a pharmacy owner or a state representative or somebody like you, Greg, who's in the thick of it. So thank you so much for giving us an update.
No, thank you. And I'm going to give you a real quick shout out here because, on the Pharmacy Podcast Network, right? I mean, you've been a magnifying voice of issues for pharmacists across the spectrum, right? Not just on PBM reform. But that said, you were calling attention to PBM reform before it was cool, as they say, right? Sure. And so I hope that you're taking some satisfaction here on a Friday afternoon as well.
Absolutely. Hey, and speaking of this is the most important question. I asked this. I'm going to ask this of our other guests on TWIRx today. But is it Patriots or is it the Seattle Seahawks?
Oh Lord, I think we're gonna have to stay neutral on that one. I'd say this, right? Seattle doesn't have the trophies that the Patriots do, so we'll go with them.
Yeah, I'm gonna go with the Seahawks because I do not want the Patriots to have more Super Bowls than the Pittsburgh Steelers.
They've got enough, right? They've got enough.
All right, Greg, thanks for being a guest on TWIRx. Hey, listen, listeners, we're gonna be right back. Hey, welcome back to This Week in Pharmacy. Thanks for staying and being part of this. The feedback that we get through LinkedIn, the feedback that we're getting on our YouTube channel. You're asking a lot of great questions. This is a shout out to you too, the listener. If there's a subject that's impacting our profession, if it's education, artificial intelligence, long-term care, clinical trial, bringing clinical trials closer to community. There's a lot happening and things are speeding up. You did hear me mention artificial intelligence, and I think we're doing 6 episodes per week, 5-6 episodes per week, and it's up to like 2, potentially 3 episodes per week that will include how important it is to understand and leverage properly evidence-based technologies into our specific sectors of pharmacy. And there's a group out there that is really coming heavy into different sectors of pharmacy. And we're going to be doing some additional deep dive podcasts. We're going to invite other organizations out there who are as dedicated as this team is. I'd like to welcome Jonathan Adley from TJM Labs to TWIRx. Welcome to TWIRx, buddy.
Thanks, Todd. I'm super excited to be here.
All right. I'm telling you what, as fast as the profession is changing, as fast as our pharmacist roles are changing and how they're going to start digging deep into clinical navigation of treatment management and of suggestion and of really becoming closer to the patient and having the ability to leverage pharmacogenomics data and having the ability to dive down into, in vitro fertilization and contraception. And there's so many verticals right now, Jonathan, to empower pharmacists. And now you guys are coming very intimately into the pharmacy space by so many of your partnerships based in the pharmacy profession. This is like 2 things colliding at the same time. The role of the pharmacist changing, and now TJM Labs comes into the picture to accelerate that based on some trust of what you've already built in infrastructure. So kick us off. Tell us quickly, because I have other questions for you. Who is TJM Labs? What do you guys do?
Awesome. So TJM Labs, we are a workflow pharmacy automation company, specifically AI automation. There is some old-fashioned automation, and there is newer kind of automation that is AI-based. The thing that we do is essentially automate. The core product that we offer is automate data entry. So if you think about faxes coming through to the pharmacy, e-prescription, refills, some of our long-term companies, they do like mid-rec. Some of them, they do chart review. All of this stuff, these bots can do it, right? And we like to explain these bots as a digital technician, which is able to work 24/7, nonstop. And depending on your pharmacy management system and the complexity, sometimes it works a little bit faster, sometimes it's a little bit slower.
Yeah, there's always adjustments.
There's always adjustment, but it is pharmacy specific. I am a pharmacist, right? Megan, our chief operating officer, is a pharmacist. And we basically, the company's built by pharmacists for pharmacies with, I would say, a lot of domain expertise in specific pharmacy workflows.
That's blowing my mind and getting me excited because, like I said in the opening, pharmacists are now going to become leaders in disease state management, best best care practices, personalized medicine and experience. Nutrigenomics is part of this, where a cancer patient that's suffering, maybe their first chemotherapy experience, they feel crappy. And then all of a sudden the pharmacist is really helping to minimize that as much as possible with nutrition or vitamins or whatever goes along with the medications. That's special. And if we had an AI engine to start collecting information like the patient's response based on app that you give them, or how they're feeling down to the 1 through 10 scale, or anything that you can personalize and even use gamification to get their response. If you could funnel that into an AI engine and now back that into our pharmacy management systems to really respond from two sides, process and getting the prescription out as safely as possible, which is the commitment, obviously, of the groundwork of pharmacists. But the more important side is reacting to clinical information, journal articles, and the response from the patient of how things are going in a specific segment of treatment. And then now having your lab organization infuse and react. I mean, that's the future of, pharmacy care, in my opinion.
Yeah, I mean, we always say that AI agents are meant for tedious work. Let AI do the tedious work and let humans do the personal and warm touch. So if you think about it, typically we all have worked in a pharmacy before. 6 out of the 8 hours we spend in there, if you're lucky, are just tedious work. You're literally sitting on a screen, hitting the keyboard and clicking the mouse with very little judgment and nuance. And in 2 hours could be consulting, could be patient care, could be truly intellectual activities. And we say, well, you don't have to do the tedious stuff anymore, right? It could be all be patient care. And then we'll have the AI do all the tedious stuff.
Hey, so our common friend Ross on your team gave me a shout out on LinkedIn, and I like how interactive your team is on LinkedIn, because that's still a platform that I see a big differentiation between Facebook and other platforms that are more consumer driven. I trust my LinkedIn network. Like, everybody that's in my network is like the real deal. And every time they talk about something, it's like I'm getting it from the source. Like, as a publisher, it's a dream. And I love this. So you're in this AI space, you're mixed into pharmacy already. Your client base is freaking amazing. We'll put a link into some of the things you guys have worked on. But you're releasing a book that's really going to help us dial into and getting more out of thinking about how should AI impact the business that I am running as a pharmacist, in order for me to assure that I'm developing the best treatment for my patients and my families of my patients, but then turn around and being able to operationalize my reporting and my staffing and this is, like I said, it's two things coming together. Would you give the listeners a kind of a quick overview of your book, and we got to get our hands on it. So let us know how to get our hands on it too.
Yeah, so we wrote this book just to let the audience know. We really wrote it for one simple reason. We want to help pharmacies succeed. Our company gets bigger when our pharmacies succeed. It's as simple as that. And if you look, on the surface at least, the pharmacy business is really tough right now. I don't know, it's not that long ago when Rite Aid went bankrupt. And right after it, Walgreens was taken by private equity, and they said publicly they're going to break it into pieces and sell it. Everybody knows how BBMs kind of routinely reimburse pharmacies below cost. Labor expenses with inflation just continue to rise and rise. So your costs are getting higher and higher if you run a pharmacy, and you're not getting any additional revenue. So if you're sitting there, it could feel like it's impossible to get ahead, right? But it's not. We're so lucky in our companies that because we work with hundreds of pharmacies, and we're not just like a tech vendor where we don't interact with them. It's a partnership. We see their businesses. We see what makes them successful. We, over the last 2 years, we saw a few things that pharmacists can do that essentially make them stand out and make them, 8-figure pharmacies, as we like to call it, right? And the 8 figure is 100 million. So, that's basically, can you run a pharmacy and get it to 100 million? and what would it take to do that. And we kind of broke it down into nice 9 chapters, and then there's a conclusion chapter of things like fundamental frameworks that pharmacies can use to grow from a job into a business, right? So
that's incredible. That's a good preview. We will have a link in the show notes to get you there. We'll make sure that we're getting you back in touch with TJM Labs. That's TJMLabs.com. What pharmacy conferences are you coming up on? Because I think we're actually attending several together. You're going to be going to which one next?
Yeah, so we as a company are going to the Pennsylvania Pharmacy Association of Pharmacies. That's coming up, I believe, in 2 weeks in February. There's also the NCBA Multi-Store Conference. In March, we have 3 conferences. We have the Alliance of Pharmacy Compounding. We have the Pharmacy Profit Summit. We also have Atrium 24. I am a panelist or a speaker in 2 of these conferences. We're also doing a podcast with the Alliance of Pharmacy Compounding just before the conference. So you should hear a lot from us in the coming few days. And obviously, Todd, I know you're very active in the conference circle, so you're probably going to be in all of these conferences. But the idea for us is we know our product work well. Lots of pharmacies kind of give us great feedback, and the idea is we want to let people know that this exists, that AI is here. It's been here for 2.5 years. It is not new. It is not experimental at this point. We feel like Lisa Fast, who's an advisor to our company, likes to say AI or die, and maybe it was hyperbole a year ago or 2 years ago, but it's not anymore, right? And it is truly the next stage of any business. It's not just pharmacy, where you have to automate and you have to have good infrastructure to scale as you move forward, where everything, like AI is basically in everything that you do, every product and in every interaction, there's going to be some kind of AI in it. So,
all right, yeah, but here's my pushback to you for just a second. You see, you came on TWIRx thinking it was going to be softball stuff.
Oh, I like it.
All right. The difference between I'm trying to build a specialty pharmacy, I have an infusion arm to it. I have a special relationship with a network of physicians that know me, trust me. I want to make some deviations. I want to go into a different disease state. I get to come to an organization that already understands that language, the positioning, the structure, the clinical, the freaking, you're a pharmacist, for God's sakes. You have pharmacists on your team. You have all this contextual structure. So here's the thing. Just like anything with the invention of the wheel, right? Yes. Everybody got the wheel. It was the people that knew how to use that wheel in a very specific manner for a very specific job and for a very specific position. And if you go out to just any old AI, I'll do it myself, blah, 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 blah. And you're like, are you kidding me? Like, get involved with organizations who understand the outcomes because they've already tried it in very specific instances that that pharmacology came into play and being able to leverage that.
Yeah, no, 100%. I mean, if you ask me today, what makes your company different than the million AI companies that are sprouting is the domain expertise. So we have about like 55 people in the company today. 45 of these are either a pharmacist or an engineer. So we have, whenever we run an implementation or work with a pharmacy, there's a pharmacist running the show. They're the project manager, right? And the only way it would work is this way, because you cannot replace domain expertise. You cannot have someone who's been working in a pharmacy and understand all the rules, the nuances, the edge cases for 10 years. There's just no way you can replace that experience with anything else.
So I also want to just make reference to when we bring a lot of things to TWIRx, we always like to bring people that have vision than just not just building something amazing and not just doing what you're doing. But you're kind of preparing for the future. So I'm sharing with the listeners now that on the blog, right before as the it's so funny when when content and when announcements come out during the Christmas season, like everybody like ignores what the heck's going on. And then when we get back in, by the time we hit February, like we're all ready to build business, like right now, right?
Yes, yeah.
There was a press release that came out on December 29th. Like who releases on December 29th? Goodness gracious, everybody's like in Christmas mode. But something exciting is you guys closed $10 million series led by Arthur Ventures. Congratulations. But the reason why I'm excited about this is we get to take our positioning as a profession by being able to partner with organizations that have that domain expertise and over and over again get to tap into more of the understanding of what it means to be a pharmacist in a very specific situation.
Yeah. And we call this in our book, right? So obviously we were racing to close our Series A before the year end just because of tax reasons and all of that stuff. But we call it in our book, one of the chapters is about if you have something that is working, most people mistake is not to think big enough, right? Like if you have a pharmacy and the pharmacy is successful and it's growing, that's it, right? They don't think, okay, how could it be 10x bigger? How could it be 100x bigger, right? And if you look at the pharmacy kind of landscape, unfortunately, let's just talk about pharmacy management system. The average pharmacy management system is like 20 years old, right? It is dominated by private equity, financially incentivized companies that don't really like to invest in their software. They like to extract rent and basically have you pay your monthly fees without really giving anything back in improving the software. There haven't been any serious investment in the pharmacy ecosystem. A lot of companies start trying to build for pharmacies, but they don't have the domain expertise, and they basically pivot to do something else. Luckily for us, we have the domain expertise. We do have the engineering expertise as well. So not only am I a pharmacist, I'm also an engineer. And it is the right time. We think AI can be transformative. If you just look at the public companies today, software companies, they are basically being destroyed because everybody looks at AI companies and they say, hey, they can move 10 times faster and they can give us better product. And it's not just software where someone has to go and click and do things, but it's software that just essentially does the work for you, right? So today, like in pharmacy, you go in, you buy, some pharmacy dashboard that show you stuff. You still have to go in and you have to read and you have to come up with what they're going to do with that data. But AI companies function a little bit different. They say, we are going to look at all the data. We're going to identify the interventions, right? And we're going to give it to you in the end and you have to approve, right? And that's the difference. When we do our automation, it's literally the e-prescriptions come in, the faxes come in. Our team sits with you, gets all the details, the nuances, what is different about your pharmacy and everybody else. And then the bot just works in the background. That's it, right? So it's going to be a very exciting time over the next 3 to 5 years, I would say.
So, it's great when you hear it from the leadership level, someone at your level, the CEO that's leading the company. But then if I jump into a team that surrounds you, you got to bring heavy hitters and you have to bring, once again, domain knowledge, because I'm not a good CEO. I think I'd be good at business development. I lead this publication, but I know my weaknesses and I know my strengths. And you being able to leverage a dream team of people who have domain experience, kind of give a quick overview. We'll have other TWIRx out there that will feature these people, but talk to me about Megan and Nasser and Mr. Ross Miller, a little bit more about the team.
Yeah, so these guys are the dream team, basically. We, at some point, your job as a CEO transforms from doing things to building the team that builds the team. If you look, so Megan is a pharmacist. She was our first employee ever. She has experience in user experience and design, which again, very, very rare for pharmacists. She truly thinks about how could we make the experience of the people on the front line as exceptional as possible, right? The company was basically built while she was in the front line very early on. So Abdullah is our director of engineering now. He was our third employee. He took over. So I started as the first engineer, and he took over everything that I do, and he runs our engineering department now. We take a lot of pride in our engineering, where it is. It's still with AI now, like you can generate a lot of code really quickly. Yeah. But there's the craftsmanship. We call it pharmaceutical elegance. Like if you're in the pharmacy and you're doing compounding, you can just mix a compound really quick.
Hey, listen, my dad was an electrician. Every electrician, the people that had 2 hours of experience and the people that had 80 years of experience, you gave them a screwdriver, right?
Yes.
Everybody had the same screwdriver. How are you going to use that screwdriver better? And that's a dumb analogy, but it's definitely AI too.
Exactly.
What about Hannah?
Yes, there's the craftsmanship. I think you're never going to be able to take that away. What you see it in pharmacies was pharmaceutical elegance. Hannah is basically our implementation superstar, right? So she manages all implementations. Just a pharmacist, loves pharmacy, really works well with other pharmacies. Sometimes some pharmacies are organized, sometimes they're not organized, but we take them all. And you probably saw Ross on LinkedIn. He's very, very active, comes from enterprise software, has been in Monday.com, have been in Microsoft 15 years, if basically doing sales. And he's our VP of sales now, and he's basically building a whole sales org under them. So I would say, some of it is luck. Definitely, sometimes you hire people and things do not work out. But I would say our first 40 or so employees have all been exceptional. And in the life of the company, we only lost 2 people out of 55, which is again exceptional retention. Hopefully we can continue this way. So,
well, when you find people that are part of a mission, it becomes more than just a job. It becomes something that you really want to have an impact. And that's the way I feel about publishing. That's why I was working a full-time position up until 2019 and doing podcast development and publishing on the side. And I had to decide, hey, if this is ever going to become something, it's time to do it 100% of my dedication to empower other people. And that's exactly what you're doing as the leader at TJM Labs. You're literally the guy who's supporting all of them. They're coming to you to become enhanced. And then your client is also doing the exact same thing. So I absolutely love this domino effect of what's happening. And it's an exciting time to be in the profession. I'll tell you that.
Yeah, it is. Yeah. And, as a CEO, you have to fire yourself from a job every 3 months, literally, so, and we've been doing that. So I'm looking forward to firing myself from some of the legal and paperwork stuff that I have to do now. So that would be exciting.
Well, it's so good to have you. I've been looking forward to getting you on TWIRx. We're excited to do some other future interviews. Every single one of the conferences I think that you're mentioning, I think we're almost going to all of them. So we're going to make sure that we get you back on the shows to give us some insights. And I got to get Ross on. I need to talk to him. I really enjoy his style. I'm kind of like more of a Ross. I'm closer to a Ross in personality of Ross than I am with you, Jonathan, just to be upfront, because I like
100%.
I like marketing. You guys,
I'm a big nerd, right? I'm a big nerd. We can talk about engineering all day long, right? And I think we mesh really well as a group. So Megan is like pursuit of excellence. She's super detailed oriented, has this like very artistic, good taste. Right? I'm not. I don't have good taste. Like what colors I should choose, all of that stuff. Ross doesn't have either. I think I'm a big nerd, right? And Ross is very, very like outgoing and social and likes to talk to people. So good group to work with. So
I tell you what, it's I I think of the possibilities of what's going to happen over the next 2 to 5 years and how pharmacy is going to look so vastly different, and excited to have seen where it came from. It's so fun. We've been podcasting 17 years to be able to track what was the profession like 17 years ago. And we're going to start cataloging a lot of that information so that you can kind of look back to the history of our profession based on, launching the industry's first podcast in 2009.
Yeah, that's amazing. 17 years. Right. The podcast was a kid, they would be ready to go to college.
That's true. And you know what? This beast of a thing that I've worked on for 17 years, it's time to kick his ass out and get him making his father money.
Exactly. Right. So
that's what I'm doing. I have the most important question of our podcast today on TWIRx.
Okay.
I'm going to ask you is, who are you voting for in the Super Bowl this weekend?
Oh, man. So I basically grew up in New York, right? And my first experience with football was watching the Giants beat the Patriots like every time they played in the Super Bowl. So there's no way I can cheer for the Patriots.
Nice. We're on the same team.
Yeah.
See, listen, I have selfish reasons. So I don't want the Patriots to get more Super Bowl rings than the Pittsburgh Steelers because I'm a Steelers fan. So I'll vote for anyone else. And by the way, if you think about it, there were some very bad calls in the Super Bowl between the Seahawks and the Steelers. And I feel like it's their turn to, get it, because there were just a couple things, that I even questionable as a Steeler fan. But I'm excited this weekend. I don't want to see football go. I'm a football guy.
Yeah, I mean, New England have been winning too many Super Bowls. Respect the hustle, right? Respect what they're doing. But enough, they want enough. Give it to someone else.
The Pittsburgh Steelers need AI. They need like a TJM Labs to come in and revitalize everything, because it's kind of a mishmash, pish-pash, who knows which wash situation right now.
We actually, that's a badge we need to earn. Get one of the sports team pharmacies. We have the Congress pharmacy, right? We have some of the...
We have sports pharmacy too. We have that guy in Miami.
Yeah. We don't have a football team pharmacy, but we'll go out and find one. So,
all right,
I'll take any, even the Patriots. I'll take it. So.
Exactly. All right. Well, I wish you a wonderful weekend. Thank you so much for being a guest on This Week in Pharmacy, and we're gonna talk more. We're gonna have you back. We got a lot of subjects that we can dive into.
Awesome, Todd. Yeah, very excited to always come back and talk. So, thank you for hosting me.
All right. You've been listening to TWIRx. Here we go.